Okay, so we are now live. Welcome, everyone. Welcome to today's Wednesday Wisdom. We have a few guests on here. Awesome. I'm admitting people as we go. My name is Tracy Thomas. I'm the Communications Manager here at the Black Chamber of Commerce of Palm Beach County. And I am joined today with Katrina Blackman, who's also with the Chamber. She's our compliance administrator. Say hello, Katrina, or wave.
My apologies, my internet went out. I had to join on my phone. Good afternoon, everyone.
It's fine. Good afternoon. We have a few members on. We're going to go ahead and get started. Mr. Keen, hi, you want to introduce yourself?
Hi, everyone. I'm Keen. I'm with Whiting Turner. Very happy for the reminder. That was so helpful to make sure I joined today. So that was great. Sometimes I get caught up with lunch and things like that. So when I got the reminder, I was like, perfect. I'm not going to miss it. So
yes, the hour before. And sometimes it's the day before, and the hour before. Yes, we always going to make sure to keep you updated.
That is awesome.
We're going to get started. Again, my name is Tracy Thomas. Welcome to today's Wednesday Wisdom. We have a treat for you today. We have Dr. Rob on. He will be introduced in a moment. Prior to us getting started today, I just want to do a little bit of housekeeping. If you have a camera and your camera is off, we'd love for you to turn it on because we love seeing smiling faces around here, And then at the same time, you're on, we want to just make sure that you keep your microphone off during the presentation. There will be a Q&A after today's presentation, but you can always drop your questions in the chat and we can grab those questions as well. Okay, so without further ado, I want to just thank our sponsor, generous sponsor for today's Wednesday Wisdom, BBIC, which is the Black Business Investment Corporation. We have Markeisha Johnson on the line. Hello, Markeisha.
Hi, good afternoon, everyone. My name is Markeisha Johnson. I am coming to you on behalf of both of my organizations, which is Palm Beach County Black Business Investment Corporation and Pathway Capital Funding. We are so excited to be here today and to be a sponsor for today's events. If you are not familiar with us, you can find us on our website, which is www.pbcbbic.biz. And for Pathway, it's pathwaycf.org. So thank you for this morning, and I look forward to an amazing time with you. Thank you.
Perfect. So we have our guest speaker today, Dr. Rob. If you don't mind, go ahead and just give yourself an intro, and let's just get started.
Good afternoon, everybody. My name is Dr. Rob. I am a physical therapist. I just started my private practice called All Pro Rehab. We are located here in Boynton Beach, Florida, and I am excited to share some really cool information on how to prevent injuries. I'm going to dive into a little bit more of low back pain, which is a very common injury that I see and treat. And at the end, if anybody has specific questions about their injuries or any causes or concerns, then I'm here to answer any of the questions. So just kind of read the room a little bit. Where does everyone live? You can type in the comments, or you guys can actually just say it. It's not really too many people in here, but where is everyone living? Where's everyone staying?
I'm in Palm Springs.
Palm Springs, okay.
West Palm Beach.
West Palm Beach in the house, okay.
And I'm in Fort Lauderdale.
Fort Lauderdale, okay, all right. And show of hands, who in this group is 100% pain-free right now? Anybody?
I would say right now I'm feeling 100% pain-free. Thank God.
100% pain-free, nothing going on. You feel like tip-top shape?
I feel pretty good right now, this moment, right this second, yeah.
Okay.
Sitting here.
Okay, anybody else 100% pain-free?
Not 100% pain-free, but I am in rural Palm Beach, Florida.
Okay. So I guess the point that I'm getting at is this is going to be some really good information to help everyone out in educating you guys on how to maintain your own bodies so you can be more healthy and more active. So my primary objective that I want to accomplish is sharing information about low back pain and about how to prevent any injuries when you are being more active. Anything, whether it's walking, taking a walk, getting back into the gym, joining one of these gyms where you take classes. A lot of those gyms don't go over how to properly prepare your body so that when you're doing these movements that you don't get hurt. Okay, so that's where I come in. I'm a physical therapist. We are movement specialists. So we analyze people's movement and we correct people's movement. And we do that in ways of diagnosing people and figuring out what is out of balance and forming a plan to get you back to where you need to be, whether it's your range of motion isn't on point, you're not moving in a way that is conducive to the activity or the task that you need to do, or maybe you're not strong enough to do what you need to do. So because you're not strong enough, you're not able to complete that. Or it's something as simple as you have an inflammation or that you suffered an injury. So now you're out of balance. So what physical therapists do is we do an assessment. We check everything to see where are you as far as your range of motion, your strength, your stability, where's your pain, and we formulate a specific plan to get all of those issues resolved so you can get back to living a normal life. So just to kind of give y'all a general definition of what PT is. What makes my practice different from the typical physical therapy practice is I only do one-on-one physical therapy. I'm not treating you and then someone else and someone else. You have my undivided attention for a full hour, and I formulate specific plans for that person. If you come in and you're saying, I feel great, all right, let's progress you. If you're coming in, you're saying, oh, I don't really feel too good today. All right, let's take a step back. Let's treat what we see that we can get you where you need to go. So that's just a little bit of generalized information. So low back pain. Why did I decide to do low back pain? 50% of Americans suffer from low back pain. It's something that's very, very common. And it's one of those injuries or situations where everybody knows somebody that has low back pain. There's about 5-6 people in here. Probably half of you guys have low back pain right now. So that's the reason why I decided to do low back pain, because a lot of people are dealing with that. So how does low back pain come about? Sitting too much. We either do too much sitting throughout the day, whether it's at home or at work. We're not active enough. We're not getting up. We're not walking every hour. We're not as active. So our hips tend to be a little bit tighter, and that can lead to low back pain. Let's see what else I got here. Impaired posture. So bad posture, sitting in the wrong position. That's also another one. And also improper lifting mechanics. You might be moving boxes, or you went to go get the groceries, and the way that you went about picking up whatever it is that you picked up, you twisted the wrong way, you weren't bending correctly, and your back gave out. So these are some common reasons why people will come in and say that they have low back pain. And again, what I will do is gather some more information about what's going on with the person, what kind of pain is it, how long have you had the pain, what feels better, what feels worse, and then I'll do my exam and I'll do a treatment. So the treatment would be, depending on what's going on, I'll have the patient warm up, and I'll take you through either some stretches, mobility exercises, and then I do a lot of hands-on stuff where I go in and I manually correct what I see. If there's a muscle that's too tight, I'll go in. People think it's massage, but we actually call it soft tissue mobilization. It's actually skilled, where I'm doing a specific technique to get the result that I need, versus a massage therapist just kind of does everything the same with everybody else. Mine is, I'm palpating for a specific muscle. I want this muscle to be released, so I do a trigger point release. I'll do soft tissue mobilization. It's more skilled. Once I get the result that I need, I move on. So last but not least, I'm educating everybody about what to do, what not to do, and giving them a home exercise program so that they can maintain the progress that we gain. So anybody have any questions about anything so far? I know I just gave like a lot of information.
You can just unmute yourself and ask a question if you have a question at this time.
You talked about the 1 hour consultations.
Mhm.
How would they go about scheduling a consultation with you if they were interested?
So you would call the office, or you can email. Or you can email me personally. My email, I'll give my personal information. My email is rob@allprorehab.com. Or you can call the office at 561-249-0053. And what we would do is we would do a phone consultation first, find more information about what is it that you have going on. We'll ask some questions, see what's going on, and then figure out if you guys are a good fit for our practice. Our practice isn't for everybody because we are primarily cash-based. So a lot of people would like to go through insurance, and even though I do accept some insurance companies, there's a lot of them that I am not in network with. So because we are primarily cash-based, what we do is we build packages for each individual that comes in, and most people that I actually see do packages. So we'll do a cash package, we'll formulate a plan, and then we schedule your first visit and then book you out for the rest of your visits, and then you get better.
Dr. Rob, do you have any suggestions or recommendations regarding, okay, let's say back braces and the proper back brace if needed if we're doing strenuous activities? Example, me preparing and clearing, my garage for a garage sale. So I'm lifting weight. Would you suggest or recommend that I use a back brace?
That's a great question. I actually would not recommend a back brace. And the reason why is because we actually have structures within our body that does the job of what a back brace is supposed to do. So the moment we put a back brace on, we're shutting down those structures within your body and basically telling them you don't have to do your job. The brace is going to do it for you. So in the immediate situation, yes, that brace is going to provide more support, but long-term wise, your core muscles are going to be weaker. So in physical therapy, what we do is we teach you how to turn those muscles on and get those stronger so that you don't need a back brace. Does that answer your question?
Interesting. Yes. So my next question, with that being said, I know we as women and we want to make sure our waist is snatched and all that. What do you say about that?
I think that a lot of the times when people have injuries or pain as a barrier, that kind of prevents people from going hard in the gym or getting back to being more active, because 9 times out of 10, it's because if someone's in pain, they're not going to want to be active. They're going to want to avoid certain movements, certain activities, because you don't want to be in more pain. So for us, we empower our patients. We give you the information. We tell you, even after, let's say you come in with back pain, we've treated you, you're 100% better, you're ready to go. I actually give you even more information on how to maintain that progress. That way you're not coming back. So once you're pain free, now you can go and do whatever gym activity or get back to a hobby that you've been avoiding for years. And that's a win-win situation in that situation.
Thank you.
Yeah, you're welcome.
Any other questions? Okay, Dr. Rob, you want to continue?
You have no questions? Oh, okay.
Sure.
She's like, nope. I'll just make sure that my connection is good. Okay, so I have a few tips to prevent just injuries in general, and I want to go through those. So when we talk about gym activities, dancing, when we talk about just traveling, hiking, these active type of movements, we have to prepare our bodies to do these movements. We can't just roll out of bed and expect our bodies to be already ready to do these movements, no matter how young or old you are. So I would say before you start that activity, 5 to 10 minutes, set aside some time to do a stretching routine. hamstrings, quadriceps. Prepare your body before you do these activities. Don't just go right straight into the activity, because that situation will have you be more prone to pulling a muscle or pulling them back, or you want to get into a stretching routine. And if anybody would like for me to email them a basic stretching routine, I would love to be able to share that information with you. And also with any questions in the chat. Okay. Also, wearing comfortable shoes that have good amount of tread on the bottom. A lot of times when people start getting into the gym and they're using the same shoes, the rubber on the bottom of the shoes tend to wear down as you're running or you're using the same shoes over and over and over again. You want to always check the bottom of your shoes to make sure that there's a good amount of tread on them. It's just like driving a car that has no tread on the tires. It puts more strain on the car, just like with your body, it puts more strain on your joints if you don't have enough tread on your actual running shoes or walking shoes. You want to also avoid overtraining. And I see that sometimes with people that tend to get back into the gym activities. They're feeling great, they're having good results, and they're not really good about taking a break. So there needs to be a balance. I would always recommend 1 to 2 days per week where you're resting and allowing your body to fully recover. Also, listen to your body. A lot of times, again, you start working out, everything's fine, but you feel something. It's like a little bit of a pull, a little bit of an ache. You have to listen to your body. You have to listen to your body. And if you need to take a day off, or if you need to seek physical therapy or a professional to make sure that it's not something severe, I would highly recommend you do that sooner rather than later. A lot of the people that I tend to treat or work with, they didn't listen to that first warning. So what ends up happening is a real injury or a more severe injury. And then now I'm having to deal with working through that severe injury and the minor injury. And that typically takes a longer time to recover from, versus if you had a minor injury, it would be 1 or 2 visits. We get it knocked out of the way. I teach you how to prevent that injury from coming back again. And then that way you can just go back to doing your gym activities or your fun activities that you love to do. Yeah, that's it. Those are the tips that I have to prevent injuries. And then last but not least, I want to go through 3 stretches that are really, really good to prevent back pain. So I have, can you guys see that table right there? Okay, perfect. So I'm going to go through 3 quick stretches. Each stretch, you should do it for 3 times for 30 seconds. Okay. So I would recommend you get one of these straps as well. You can find this on Amazon. It's called a stretch strap. First one. Can you guys hear me okay? Okay.
Yes.
So, knee is straight, and you just pull it straight up this way. You would do that 3 times, 30 seconds. The second one is you coming up and over and lifting this leg up. I'm going to show it to you on the other side. Up and over. Lift that leg up. Third one, super simple. The knees are together and you're rocking side to side. Did you guys see that?
Yeah. I do have one question.
Yes.
Dr. Rob, when it comes to sleeping, is there a particular mattress that's best if you have back pain? Like, should the mattress be more firm? Should it be soft?
I get this question all the time, and the general answer that I like to provide is everyone's different when it comes to mattresses and your preference. If you do have low back pain, I would recommend a more firm mattress that has a pillow top.
Mm-hmm.
That way you have that soft feel on the top of it, but you have that support from the actual mattress. Does that make sense?
Okay. Yes, it does. Thank you.
You're welcome.
Great demonstration, by the way. That I think that was like the first time we've ever had a demonstration. How cool was that? You starting a trend, Dr. Rob.
Well, you know, I just wanted to make sure that I did something more active, because this is something about people getting more active. So for me to just talk and talk and talk, it's not going to be really retained. I think it'd be better to engage people and kind of show you some stuff that you could do that's very simple, very easy to replicate. And at the end of the day, it's going to help you.
Yes, yes. We do have a question. You say firm, but what mattress?
I wouldn't recommend any specific brand or anything. I would say I wouldn't buy a bed that I haven't actually laid down on in person. So one of those beds that are online, I would recommend that, because there's no way for you to get a good feel for it.
Dr. Rob, you were describing the mattress. You were saying you want it to be firm, but you also want it to be something else. And
I have a pillow top.
Pillow top. Okay.
Pillow top. Yes.
Thank you.
Yes. The more expensive mattresses. Pillow top. Yes.
And sometimes the expensive mattresses aren't necessarily the most comfortable. So just because something costs a little bit more money, that doesn't mean that it's for you specifically. I would recommend that you walk into Mattress Firm and try the different mattresses that they have. Don't get caught up into the price, because sometimes something that's more expensive isn't necessarily more comfortable for you individually for you.
Good point. Good point. So is there any other additional questions at this time?
I have a question. What's the average range as far as age of your patients? Is there a minimum age limit that they have to meet?
I have a wide range of patients that I'm treating. As far as right now, my youngest is 19 years old and my oldest is 84 years old.
Wow.
So I treat anyone. My preference is to treat more active people. I don't want people in here talking about, I don't want to do no exercise. I don't want to get on the bike. I don't want to, because a lot of what physical therapy is we have to correct your movement. And the way that we correct your movement is by doing specific stretches and exercises. Now, I would never give somebody something that I don't think they can do. But if you are able to do a movement, if you are able to do an exercise, then I'm going to have you do that, because the way that I treat is basically it's based off of research. And the research says that we have to do exercise to improve movement. We have to. I'll do the hands-on stuff. I'll get you feeling better. But in the long run, you have to do specific exercises in order for you to actually experience the long-term success that you need.
Mm-hmm. That makes sense. I appreciate you mentioning the fact that you suggest to recommend that we rest 1 to 2 days before hitting the gym again. You know, because somebody like me would just try to overdo it, you know, but being able to rest like that, that's good to know.
And to piggyback off on that, I work a lot with the local gyms that are in the area as well. And I've done some workshops in educating them. I would recommend you take at least 1 day off during the week and 1 day off on the weekend. Okay. And the reason why is because when you go into your routine of doing something active, whether it's walking every day, you're joining the gym, you're taking classes, you don't want to do 4 or 5 days in a row, because that's still as strenuous as doing 7 days in a row. You're not giving your body an opportunity to break. So for example, I'll tell you what I do. I go to the gym Monday, Tuesday. I take a break on Wednesday. Then I go Thursday, Friday. Then I take a break on Saturday. Then I stretch on Sunday. So on Sundays, I don't even work out. I just do yoga, stretching, recovery. But then I'm still going to the gym 4 days in a week. I'm active 5 days in a week, but on that 5th day, it's more of a stretch, mobility, injury prevention day.
Very good.
Does that make sense?
Yes, it does. It does.
And in the long run, and that's why I tell people, in the long run, that structure is going to be more beneficial towards you versus you going hard. That's not sustainable.
Yeah.
Dr. Rob, I have another question. Is it beneficial to do certain parts of the body on each day, like upper body on Monday, lower body on Tuesday, and so on and so forth?
Yes. I would say that's a generalized approach where you can focus on certain body groups. That way you're not overtraining one versus the other. And it also gives you an opportunity to, let's say you work the legs today. Tomorrow you could work upper body and then your legs are resting. So it doesn't make sense to work the same muscles over and over and over again because you're going to start ended up overtraining. Another way that you can approach that is finding different activities that you enjoy doing. So if you like to dance, you can do dancing on one day or take a dance class. If you like to take walks, you can do that the next day. It doesn't necessarily have to be the gym, because I know sometimes people they're not fans of the gym, but I think the key to, again, long-term activity, long-term success is finding a fun way to do it.
Dr. Rob,
Yes, sir.
I have a question. Those are 3 great stretches that you showed us for lower back pain. Can you show us on the table one simple abdominal exercise, which we all know that the ab muscles support the back? Can you show us an ab exercise that's real easy to do?
Absolutely. What I'm going to show you is called the Forearm Plank. And the reason why I'm showing you the plank is because it's the safest to do. Whether you have back pain or not, you still should be able to do a plank. And as a matter of fact, the plank turns on 2 muscles that actually stabilize the back: the transverse abdominis and the multifidi. So these are 2 very beneficial muscles for lumbar stability. So by you doing that plank, you're getting a benefit from, slimming the waist down a little bit, but also from a PT perspective, you're also strengthening your core muscles to the point where your back pain can be decreased. So it's a 2-for-1. So I'll show you the forearm plank. Can you see the table? Let me see. Make sure. Okay, good. All right, here on your forearms, and you want to be up like that. And you want to make sure that you're completely parallel.
Just hold it for a second.
Dr. Rob, you made that look easy. How long do you hold it for?
So depending on the person, I would usually start off very small amount, 10 seconds. I would start off with 10 seconds, and you would break that up into at least 3 sets. So, but if 10 seconds is too easy, then you'll do 20. So I'll increase by 10-second increments, 20 seconds or 30 seconds. So to me, someone that has really good core strength, it can sustain that position for 1 minute. So for example, if I have somebody that has low back pain, I'll test their plank and say, okay, how long can you hold that plank? Usually when someone's coming in, they could do it for about 10 seconds or maybe a little bit less. And by the time I'm done with them, they can do a 60-second plank.
Wow. That's a great goal. Thank you, Doc.
You're welcome. And again, a lot of these exercises and stuff, I like to teach what you can do on your own. I'm not gonna add all these special equipment. I do have a full gym, but a lot of the stuff that I end up teaching my patients is stuff that they can do on their own. And that's the key. You're not gonna be in physical therapy forever. My goal is to treat you, get you better, and then show you how to do those exercises on your own so that you're not having to come back.
Awesome. Awesome, Dr. Rob. Thank you so very much. I mean, this has been like the best Wednesday Wisdom session with the demonstration piece. So thank you for that.
Yeah.
Thank you for that. I think if there's any other questions, we want to go ahead and move forward so we can give your afternoon back. Okay. At this time, we'd love to just be able to announce our newest members of the chamber. Katrina Blackman, she shared it in the chat, but if you don't mind calling those names out real quick.
No, not at all, Tracy. And if we have any on the call, which I'm not sure, I don't think we do, but welcome our new members, American Cancer Society, Velocity Community Credit Union, Tech Support, Gains Claims, the Bold Foundation, and I'm not sure how to do this one, but it's LVNDR Life.
Yes, that's Lavender.
Lavender. Okay, Lavender Life.
Beautiful, beautiful
Very
spa
different.
off of Northwood. Beautiful spa. We got to make sure we're visiting.
Oh, well, we're going to have to do that. Yes, yes. Love a spa day. Self-care day for the ladies and the gentlemen. Self-care day.
Absolutely, absolutely. Do you want to announce the events or you want me to?
Yes, actually, I'm going to, let me enter right now, but I just included our two upcoming. We have one, Young Professionals has an event tomorrow, State of the Young Professional, July 28th. And I put the register link in there. But our grand reopening for the chamber, August the 11th, is the one that I would like to highlight. That's for our members. We would love to have you come out. We are doing a ribbon cutting ceremony, getting back into the season. And if some of you may know, some of you may not know that August is National Black Business Month. And so we want to honor that by just, kind of doing a grand opening, let you come in and see the facilities. We're going to have some vendors. And do we still have spaces or has it already sold out?
We have 2 more spaces left.
We still have 2 more spaces. And that register link is in the comments as well. And we would love to have you guys come out. We'd love to meet you in person. And you'll get a chance to meet some of our board chairs, our board president, and just hear about the benefits of the chamber and things that we have coming up and get to network with other like-minded individuals like yourself.
Yes, thank you, Katrina. Thank you for that. And we do have Mr. King on the line, who is our event sponsor for the grand reopening with Boynton Turner.
Nice to meet you. Awesome.
Thank you. Thank you. We appreciate you. And thank you for supporting the Black Chamber. King, we really appreciate that. So you guys, unless you have any other questions, we thank you for joining us today. Giving you remarks on behalf of Grasford Smith, who is unable to join us today. Our president, he wants to bring greetings and he thanks you all for joining us today. Dr. Rob, amazing job. You guys make sure that you follow Dr. Rob on all social media platforms. He is amazing. Thank you, BBIC. Oh my gosh, Marquise, we appreciate you. Thank you for everything that you do, and thank you for sponsoring today's Wednesday Wisdom. Okay, yes. You guys enjoy the rest of your day unless you have, what's that, Dr. Rob? I
said, if you don't mind, I'm going to share my contact information one more time. If anybody has any specific questions or anything. So my email is rob, R-O-B, at allprorehab.com. Our number here at the office is 561-249-0053. And like she said, social media, we have Instagram, we have Facebook. It's at All Pro Rehab. Very simple.
Very simple, short and easy, very good. And thank you all again for joining us on the social media channels, because we are live. So I want to make sure to acknowledge everybody that's watching us. If you have any questions, even if you're watching the replay, still make sure that you drop those questions in on YouTube and we can get them answered for you, okay? You guys enjoy the rest of your day. Thank you.
Thank you so much.
Bye.
Have a great one.
You too.